Good afternoon. It's my great pleasure to be here. For those of you who don't know me, I'm Bruce Jarrell, the president of UMB. It's been a wonderful position to be in, and one of the most wonderful parts of the position is getting to choose deans for the various schools. And one that I've got great pride in and pleasure in appointing is the Dean of the School of Nursing today. And obviously, you already know her, but I've had the great pleasure and honor of working with Dean Yolanda Ogbolu now for the past, she tells me, 9 months. Time does fly. It's been amazing. She's been terrific to work with. She certainly fits in with all of our deans very well. And what I'm most impressed with is she's got new ideas for the School of Nursing, which I think is always a welcome thing. No matter who came before you, you can always make it better. So with that, she's going to address you today. She tells me it's going to be 45 minutes. That's my kind of talk. So Dean Ogbolu, welcome.
Good afternoon, everyone, and thank you so much for being here for my first State of the School address as Dean of the University of Maryland. It's my pleasure. It's my pleasure to see so many familiar faces in the audience, as well as some new faces. Today, I have the honor of highlighting the remarkable contributions in nursing education, research, practice, and service. While I could spend the entire day, because there's so much amazing work going on here in the school, please know that we are under a time constraint. So to my faculty, to my staff and students that are here today, I hope that you know that I'm grateful for each and every one of you. I encourage you to peruse the program. Everybody should have a copy of it. The program is a comprehensive overview which showcases the names of the outstanding leadership, not only here in the school, but across the campus, as well as the University of Maryland medical system, which is a very important part of what we do here in the School of Nursing as well. It notes the commendable achievements from the School of Nursing from April 1st of 2023 to March 31st of this year. For this year, our School of Nursing has been in both a year of transition and what I say is a year of hope. Most of you know that hope is my mantra, and I believe in hope as an action word. Today, we will highlight our progress, and we will put them in a few buckets. That includes our achievements in the area of student success, community and global health, well-being and belonging, interprofessional research, and leadership in nursing education, research, service, and practice. I would like to begin by acknowledging my colleagues, our provost, Dr. Roger Ward, my fellow deans and UMB administrative officers. Thank you so much for your support. I also want to welcome our members from the University of Maryland Medical System and the University of Maryland Medical Center. In addition, I will welcome our School of Nursing Board of Visitors. I'm so grateful that many of them are here in person today. So I want to thank our Board of Visitors and the Alumni Council, and thank you for your dedication. Their names are listed in the program, but I particularly want to recognize the board chair, retired Rear Admiral Elizabeth Niemeyer, and the chair of the Alumni Council, Dr. Tracy Showar Morgan, and thank them for their leadership. And most importantly, by the energy that you could feel from the room, a special thanks to the senior administrative leaders and the academic leaders here in the School of Nursing, and to our faculty, to the staff, and we're honored to have students here today. So the success of the School of Nursing depends on each and every one of you, and I am honored to serve as your dean and so grateful for all that you do. I also want to publicly honor the past deans. When you look around this room, you'll see the pictures of our previous deans on the wall. And if you look over to the right and closest to the stage, you'll see Dean Emeritus Dr. Jane Kirschland. And I must say, I'm so grateful to follow this amazing leader who so thoughtfully prepared us for the transition this year. Jane Kirschland was intentional and she was strategic in her desire to leave the School of Nursing a better place to work, to learn, grounded in civility, respect, and inclusion. We're fortunate as a school, and I am especially grateful to follow in her footsteps. So in her absence, I would just like to send her thanks. Since assuming the role of dean, I've had the privilege of engaging in conversations with faculty, with staff, and students, both here in Baltimore and at the universities at Shady Grove. I've been filled with hope following many of the thought-provoking conversations. I vividly remember one unforgettable conversation. It was a student who came to my candidate interview. He gave me a glimpse of what it means to be a student here in the School of Nursing. He and his peers arrived very early in the morning. They had to get here about 8 o'clock in the morning to have an opportunity to be here for the interview, and he was well prepared. He had a very long list of questions in his iPhone, and he was unrelenting and asking me challenging questions and also sharing potential solutions for how we as a school could do better, how we could support students so that they felt like they belonged, and that how we could develop an environment where we left no student behind. I left that conversation thinking, wow, that was a lot. This early conversation really helped to prepare me for what was coming and left me with a sense of hope and optimism for the future. Over the next few months, I've also met with numerous alum, including our museum docents, who remind me that the challenges we have today, like the nursing shortage, are so similar to the challenges they also faced when they were nurses. I attended meet and greets throughout the region with our alum and met with donors and our Board of Visitors and the Alumni Council. These listening sessions has allowed me the opportunity to learn not only my hopes and dreams, but the hopes and dreams that all of our stakeholders have about the evolution of the School of Nursing. Thank you to everyone who has generously shared their knowledge. It will be used to propel our school to even greater heights. Thank you. Thank you. Students are at the heart of everything we do in our school. We measure our success in terms of their success. And in the words of our mission statement, we shape the profession of nursing and the healthcare environment by developing leaders in nursing education, research, and practice. So what does it mean today to be a student in the University of Maryland School of Nursing as we prepare a new generation of nurse leaders? We are privileged to welcome students that are not the students from 10 years ago. They are bold, they're forward-looking, they bring with them vastly different living experiences that have shaped who they are and their expectations. The average age of our student is 29. Meaning that they were born in the 1990s or later. They've never lived without a smartphone or social media. That's not true for all your faculty and other leaders, but it is true for our students. Our students know what they want to be taught and expect that those of us that are in academia have kept pace with the changing society. They want to receive an education that's relevant in real-world settings and to be offered opportunities to learn in ways that leverage the metaverse and artificial intelligence to help them learn faster and be prepared for the realities that they will face in practice. Here in our School of Nursing, we are delivering on many of these ideals of futuristic learning through activities like virtual reality simulations, Special Olympic athletes who come as standardized patients to teach our students how to care for persons with limited ability, through lessons in artificial intelligence from our nursing informatics program. We're also educating students here in the School of Nursing when the very concept of how and what students need to learn is changing. A major redesign of the nursing curriculum is underway, and it impacts all nursing schools across the country and all programs within our school, from entry to practice to advanced practice nursing and our Doctorate of Nursing Practice program. The new curriculum, called the Essentials, Core Competencies for Professional Nursing Education, is focused on preparing practice-ready nurses. So it's no longer about what students know and can check off on an exam, but it's all about, can they apply what they know? I'm proud to say that the School of Nursing was among the first schools in the nation to complete our revision for our entry into practice baccalaureate curriculum. As of fall 2023, all BSN students are now being taught in the new curriculum. And this semester, we will graduate the first cohort that has completed the whole cycle of courses. I applaud the faculty, the staff, the associate deans, the department chairs, the curriculum committee. I can only imagine what that was like, for your dedication and your hard work. I want to especially mention Dr. Dawn Mueller-Burke, who worked very closely with the American Association of Colleges of Nurses and played an instrumental role in the implementation of national workshops that's not only helping our school, but now we're helping other schools across the country. Our collective work as a school was published this month in the Journal of Professional Nursing and highlighted by the AACN. Thank you, Dawn. Multiple factors are at play that require, as a leading nursing school, we keep pace with society. We are educating nursing students at a time when Maryland is facing a critical nursing shortage. As a statewide institution and one of the largest schools in the country and a top 10 nursing school in the country, people look at us to innovate and to address the challenges. In response, we have committed to expanding our entry to practice enrollment over the next 3 years. We must also meet the demands that come with increased enrollment, including the shortage of nurse educators, the need for physical space to teach, and the fierce competition which many of our health professional schools can relate to for clinical practice sites and clinical preceptors. Our team in the Office of Student and Academic Services has the daunting task of finding clinical placements for all of our students. To give you a sense of what this really means, just for the spring semester, 1,875 students were placed in slots across the entire state of Maryland, including in rural communities on the Eastern Shore and Western Maryland. And even with that, it wasn't enough. So some students were placed as far as Virginia, the District of Columbia, and Pennsylvania. And yes, we still have clinical placements in the evenings and on the weekends. So I really want you to know that it takes a team of 10 individuals across the school to manage the multiple tasks of identifying and securing clinical sites, building the relationships with our partners, developing formal agreements, and ensuring student compliance with all the rules and regulations. One great activity that happened this year was to enhance synergy, not just for us, but across the state for nursing schools and to decrease regional competition. Our team and the Student and Academic Services, specifically Lori Harris and Sean Robinson, recently co-chaired the Maryland and DC Collaborative as it revised compliance and the placement process, not only for our school, but for nursing students throughout the region. So we're really excited to have had a leadership role. On behalf of the students and the faculty, I want to thank all of the staff that's responsible for clinical placements for their dedication to our student success. We really appreciate you. Just as students are the heart of the school, our faculty hold the key and open the door to student success. In education, lots of people are talking about AI and the possibility of artificial intelligence replacing educators, and the way that students now get information will be replaced by AI. But what I can say is AI will never replace the human connection. Having a nurse educator that cares, somebody that understands, somebody that supports our students is vital. Nationally, schools of nursing across the country are grappling with recruiting and retaining faculty. Approximately 33% of nursing faculty are expected to retire by 2025. And there's a need for innovative approaches to ensure the availability of nurse educators. Dr. Susan Benden, our Associate Dean for Faculty Development and Director of our Institute of Educators, is addressing that challenge by launching a first-in-the-nation program to create a robust system of preparing, supporting, and mentoring new faculty. Funded through an Innovation Challenge grant from the Bedford Falls Foundation, our nursing professor residency program for outstanding faculty is a year-long program for faculty who are new to teaching or those who are new to teaching in a complex university setting such as ours. Our Institute of Educators is also leading the way on reducing the shortage of clinical instructors. That's another area that's really competitive across the state. Supported by a series of statewide grants, the Institute has provided nearly 650 nurses in the clinical setting with opportunities to acquire teaching skills and to become expert clinical instructors. You might wonder why that's important. It's very important because for every faculty member that we're able to train, it means that an additional cohort of 6 to 8 students can now be taught in the clinical setting. To date, this work has resulted in increasing capacity by more than 3,000 nursing students each semester throughout Maryland and the region. So we're really excited about what the Institute of Educators is doing to help us recruit and retain not only nurse educators, but also nurses in clinical practice. Another essential element of student success is expanding learning opportunities in the community. For nursing, the Future of Nursing 2020 to 2030 Charting a Path to Achieve Health Equity report is critically important. It charges us as the nursing profession to develop a roadmap for the essential role that nursing must play in addressing social determinants of health, health equity, and the profound inequities within our health system. It calls for improving the well-being of the population rather than a focus on individuals. Given this shift, the next generation of students must be equipped to not only work in the hospital, but also to work in the community, as well as working virtually.
Giving back to the community is one important thing that we need to know as nurses. Some people don't even have PCP, some don't even have health insurance. We have a patient that was asking if we could give him an idea on free mental health programs. We were able to do that. So it's not just about working in the hospital, but then helping people around you.
So there's a lot of people who can't always get to these kinds of things or go to a doctor. So it's really nice when the things come to the community instead of the community suffering or, not having access.
People coming into the library may have different backgrounds, resources, education levels vary, so we try and meet them where they're at.
For nursing, a lot of times it's bedside nursing right outside of school. That's where they're ending up. And you're very focused on the patient and what's happening in the inpatient setting. And this is really giving them a picture of what life is like outside of the hospital.
Community programs are not new for our school. We launched our Master's in Community Public Health 55 years ago. Our community partnerships contribute to student learning while at the same time really serving the needs of our local communities. Our new partnership that you saw there is with the Ena Pratt Library System, with the leadership from Teresa DeSeta, Dr. Michelle Spencer, and Rachel Perrin. Over 100 students have participated since spring 2023 and providing general health assessments, blood pressure screens, referral services, and health literacy and medication education at multiple branches of the Ena Pratt Library System. Over the first 2 semesters, the program has touched 377 community members. This innovative healthcare in the library concept has also moved beyond Baltimore. Other libraries heard about it, very excited, and the program has moved to Prince George's County Memorial Library System as well. Overseen by Dr. Crystal DeVance Wilson, it engages our nursing students from the universities of Shady Grove. Another notable example is our Governor's Wellmobile, which has historically provided primary care services to vulnerable and underserved populations in rural and urban communities across Maryland. Over the 30-year history, the mobile program has provided more than 77,000 patient interactions. This year, the group has largely served in Prince George's County, often seeing people from the Latinx community for which Spanish is the primary language. The Wellmobile utilizes a bilingual community outreach worker and a bilingual nurse practitioner to provide care to patients who might otherwise not receive health care. Thank you. We are also, the last program that I'll share with you is another program that is impacting West Baltimore. It's the West Baltimore Rich Collaborative, which is funded by the Maryland Community Health Resources Commission to address hypertension and social isolation in collaboration with UMMC, the University of Maryland's Community Engagement Center, and 12 other community partners. Collectively, the program has reached 4,000 community members over the last 2 years. So very exciting. Thank you. So student learning at our school takes a lot of different venues. We're fortunate to have a robust system within the School of Nursing, and we also partner with the University in Global Health. Global engagement and education is one of the themes of the university's strategic plan. And our school has responded with strategies to expand opportunities to support student engagement. In June 2023, our Office of Global Health organized a 2-week global health trip to Tanzania, led by 2 faculty members, Dr. Elias Snyder and Dr. Charlotte Mwogogo, and supported by a facilitator and local guide in Tanzania. Students learned about the Tanzanian health system and care delivery models and met with Tanzanian nursing students and partners from government and nonprofit sectors. The program included school screenings, clinical observation, and a needs assessment for a malnutrition program.
Global health is not just coming from one country to another country and giving them the answers or finding the cure of things, but it's a bi-directional way of learning. We're also taking back to our country and how we can care for our patients with things that we have learned here.
Some words of wisdom that I have for future global health students is one, to apply, because you never know the kind of experience that you're going to have, and I promise you it will be profound, and there's a place for everyone in global health, no matter what you thought you were going to do with your nursing career. No matter what you do, you can help.
Thank you. Let's give thanks to our students for raising their voices there. These experiences provide students with the opportunity to really develop cultural humility and improve their cross-cultural communication. And so it has implications globally, but also in our local community. I hope that by listening to students today, that our students that are here in the audience will reflect on the comments of their colleagues and take advantage of opportunities to participate in global health activities that we have right here on campus, as well as global health activities that might include travel. In the summer of 2024, students will have the opportunity to travel to the eastern part of Nigeria in Owerri. This opportunity is being led by Dr. Mwogogo with funding from University of Maryland's President's Global Impact Fund and in collaboration with colleagues from Yale University. The BRAVE project, Building Resilience and AIDS Care Through Mental Health Valor and Empowerment, aims to integrate mental health services and HIV care by building the knowledge, capacity, and skills of doctors, nurses, and community health extension workers. These many varied opportunities for student participation speak to the school's commitment to addressing a wide range of needs locally and globally. Thank you. Every day, we actively uphold our core values of respect and integrity, and equity and justice through our commitment to equity, diversity, and inclusion. Not always getting it right, but remaining dedicated to learning from one another. We strive to honor and leverage our differences and our similarity by fostering a cohesive and inclusive community in the School of Nursing. The School of Nursing is exceptionally diverse. As such, we are on the leading edge of responding to the growing appreciation and need to diversify the healthcare workforce. Over 62% of our 2,000 students identify as racially and ethnically diverse, compared to just 37% a decade ago. We know that diversity encompasses far more than race and ethnicity. It encompasses various identities and also intersectionalities, including those who identify as LGBTQ, students who are parents, or students that are in the military, first-generation students, and students with English as a second language. This diversity among our students, our faculty, and our staff broadens and enriches our environment and provides great experiences for all of us. It exposes our students to a wide array of different perspectives and backgrounds, which will prepare them to make meaningful contributions in an increasingly culturally diverse and interconnected world. Our ongoing efforts to foster diversity, equity, diversity, and inclusion continue to be recognized nationally. This year, for the 6th time, we received the Health Professionals Higher Education in Excellence and Diversity Award, known as the HEED Award, given by Insight into Diversity magazine. This is the only national initiative honoring individual institutions for their commitment to diversity and inclusion. I'm proud of the School of Nursing's progress, but there's much more that we can do. In June 2023, we welcomed Dr. Yvette Conyers, our 2nd Associate Dean for Equity, Diversity, and Inclusion. And since she's arrived, our efforts have continued to expand. Dr. Conyers and her team are currently leading multiple initiatives in the School of Nursing, including participating in a 3-year Macy's Foundation grant, which is given in collaboration with the AACN to only 12 schools across the country to develop a learning collaborative that will develop programs to promote an inclusive environment for all of our students. Thank you so much, Dr. Conyers, for what you're doing. Ensuring the success of every student extends beyond classroom lectures, clinical experiences, global learning opportunities. We are committed to fostering a culture of belonging and inclusion in the school. This culture prioritizes the holistic health and well-being of every person in the school, while also infusing elements of fun into our work of learning, teaching, and supporting our students. Thank you all, thank you all. Our dedication to fostering belonging and inclusion is deeply connected to our core values of well-being and sustainability. We're committed to it. We've implemented a 1 meeting-free day per week. We also have 2 times a year, we have meeting-free weeks and events that focus on the importance of human connections, as what you've seen there in the video. We embrace these breaks from meetings, not only because it enhances well-being and but it also increases productivity. It provides us with opportunities to take reflection, for critical thinking, and an opportunity to complete the many, many tasks that are piling up on our desks. As part of our strategy for enhancing student engagement and student sense of belonging, we developed and expanded our orientation program for entry to practice students. The Pathway to Nursing program builds a sense of cohesiveness and camaraderie among our entrant students, enabling them to be better equipped to support each other for their academic success, that idea the student had of not leaving anybody behind. This past year, the orientation program culminated in the final ceremony where students received a white scrub jacket and also individual messages of encouragement from our alum. Over 75 alum regularly contribute to this effort each semester, and their financial contributions purchase the jackets, and their individually written messages to students provide a word of encouragement. This program is exciting because it's creating generational human connections between our nursing students and our alum. Our state of the school would be incomplete without discussing our programs of research. We have faculty expertise in diverse areas from bench science to community engaged research, including researchers that are focusing on symptom science, chronic pain and addictions, omics, aging, health equity, maternal child health, and palliative care. These expert researchers are all important in their own merit, but I will focus on the newly funded activities for this year. On the screen is an article from National Geographic. It is highlighting Dr. Luona Kaloka's amazing research on the potential of virtual reality therapy for management of chronic pain and addiction. Dr. Kaloka is a professor in the Department of Pain and Translational Symptom Science and director of Placebo Beyond Opinion Center, one of the school's 5 research centers. Her work was also highlighted in the news this week, in case you saw that. So congratulations to her and the researchers in the Department of Pain and Translational Symptom. In the School of Nursing, we understand that research is not a solo sport. It requires teams that make you stronger together. To accomplish the nursing mission, we've embraced the need for a broader community of expertise. We have committed to interprofessional collaboration, and we've worked with almost all schools on campus. An outstanding recent example of the benefits of cross-campus collaboration is Dr. Rachel Bremen's receipt of an R01 research project for $1 million from the Agency for Healthcare and Quality Research. Dr. Rachel Bremen is the first University of Maryland, Baltimore KL2 Career Development Award recipient from the ICTR who was successful in being awarded a federal R01 grant. Dr. Bremen's work addresses the national priority for improving maternity care, which we all know is an issue, especially as it pertains to disparities in morbidity and mortality. Dr. Bremen's partnership with her co-investigator, Dr. Esther Villalonga Alaves, Associate Professor of Practice, Sciences and Health Outcomes Research in the School of Pharmacy, has been fundamental to the successful design and ongoing execution of this project.
My research is in shared decision-making and developing a measure for maternity care in shared decision-making. And Esther Villalonga Olives is a faculty at the University of Maryland at the School of Pharmacy, and she and I are working together to really make sure this measure is culturally and linguistically appropriate for the use in Spanish. Esther's expertise is in epidemiology and patient-centered outcomes. It really ties in nicely with my expertise in nursing. And because she's also Spanish and I was a Latin American Studies major for my first bachelor's degree, we're able to really collaborate in that way to make sure that we're hitting all the different cultural aspects for translating the measure as well as keeping it patient-centered. And when we collaborate, It's really about providing patient-centered care, but also looking at these different and diverse populations and what each of our levels of expertise and clinical backgrounds brings to that. Without the diverse collaborations across the campus, my research program would not be where it is today, and I wouldn't have had the kind of success in obtaining federal funding that I've received. You can't have all the expertise yourself. You have to bring in other people, otherwise it's not as meaningful.
So thank you, Dr. Brenman, for those comments. We're also fortunate to have Dr. Barbara Resnick, who recently received a 5-year, $2.13 million grant from the National Institute of Health's National Institute on Aging. The project addresses the treatment of pain in nursing home patients with dementia. It's evaluating how to implement the new pain management clinical practice guideline, and it will test how to improve the ways in which pain is assessed, diagnosed, and managed. This is an important issue because 30 to 80% of residents living in nursing homes experience pain. This year, Dr. Resnick became our new Associate Dean for Research, and we could not be happier. Dr. Resnick is not new to the school. She's a distinguished university professor and was prior recipient of the University System of Maryland Wilson H. Elkins Professorship. The final researcher that I want to share about is Dr. Kim Mooney-Dole. Dr. Mooney-Dole is the recipient of a 2-year R21 grant from the National Institute of Nursing Research. Dr. Mooney-Dole will collect interview data from parents and adolescent siblings of children that are living with serious illness to determine the interventions which will support families. The goal is to help mitigate the poor outcomes related to bereavement and survivorship. These are just a few examples of the great new research that we have happening in the School of Nursing. We have so many other wonderful ongoing studies, and we look forward to sharing more in the future. No discussion of collaboration would be complete without talking about our long-standing collaboration with the University of Maryland Medical Center through our partnership called Nursing. The partnership was established in 2007 to strengthen the transition from student to professional nurse and to foster continued collaboration among practicing nurses. Nursing was recently expanded to go beyond the medical center across the system. Since its creation, the Dean for the School of Nursing and the Chief Nursing Officer of UMC have served as the executive sponsors. I have the privilege of now serving with my colleagues, Dr. Lisa Rowan and Karen Dole, and co-chairs for the Nursing are Dr. Jenny Day, who I thought I saw here today, and Dr. Elizabeth Gaelic from the School of Nursing. It is an opportune time to reflect on the contributions and legacy of our colleague, Dr. Rowan, as she prepares to retire, and as we welcome her successor, Dr. Peggy Norton Roscoe.
We have 2 world-class organizations on either side of the street. You never have to leave to continuously and professionally develop as a nurse. You can graduate from the School of Nursing, come work with us, go back to the School of Nursing just across the street. And I think that now we've demonstrated that it's a successful model. It was a great concept. And we have expanded it to the system. We said, what if we both jointly fund some small research proposals that we believe would be great proposals for understanding how to better care for patients, as well as establish future researchers and also provide seed money for looking at potential larger grants. My hope is that we continue to advance our partnership and innovate together, because I think that it is our two worlds that are constantly informing each other. Another hope is that we focus on the other things we can do that we haven't started doing together yet. So EDI work, social determinants of health, I think are areas where we can really put our heads together to thrive.
I want to take a moment to publicly thank Dr. Rowan for her visionary leadership, her collegiality, and her commitment to nursing excellence. Dr. Rowan, for all that you have contributed to UM Nursing, to the School of Nursing, and to the nursing profession, best wishes from our entire school community as you prepare to retire. Doctor, I hope you feel the love on the video. Dr. Rowan's comments are a reminder of the critical importance of nursing leadership. There are so many ways that the School of Nursing faculty participate in leadership, both at the local, the state, and the national level in organizations. This is in keeping with our commitment to the mission of the school, which is to have leadership and to improve the human condition and to serve the public good of Maryland and the society at large.
Nurses represent one of the largest workforces in the United States and have long been the #1 trusted profession. So our peers and our colleagues look to us to lead. They look for our courage, they look for our innovation, they look for our spirit of leadership.
Being at the forefront of changing health policy and health care is critical work for us to do as nurses.
We also have many different levels of nursing that we need to advocate for. Anywhere from the certified nursing assistant, the non-certified nursing assistant, all the way up through advanced practice nursing. So it's very, very critical that we be at a number of different tables.
When you think about the work that nurses do, they not only work really closely with patients on a day-to-day basis, but they have a really detailed understanding of what every other healthcare professional does within the organization, and often are tasked with some of those jobs when those other individuals aren't there. So when they sit at the health policy tables or at the organizational level, they bring a level of understanding that really no one else does.
Many nurse leaders that are really forward in their advocacy roles can help affect change so that healthcare shifts to a more equitable, just kind of healthcare environment for our patients and families and their communities.
You're really serving as the voice for nursing. And it's a real opportunity to demonstrate more about what the profession can and does do.
For me, it's the relationships that we're able to build in leading various organizations and committees at the national level that help to ultimately get the work done.
It really is, first and foremost, a tremendous amount of energy that you have to bring that goes along with the passion for the charge that you feel you want to lead. A bit of grit and perseverance, because there are barriers for sure that you have to navigate, but don't quit. And then I think lastly, you have to be super intentional about wanting to connect with people.
Understanding that leadership isn't definition based. You can be so many different types of leaders, but use your strengths that you have had reflection and time to discover, and use those to help guide how you're going to lead organizations or how you're going to lead people.
There's room for everybody to lead organizations, and the expertise that people bring when they don't have lots of experience is just that. They see things from a very different view.
It's an opportunity to influence change. It's an opportunity to have a voice and be at the table. And I think Maryland has a reputation for being leaders, and I think it's part of our obligation and part of our commitment.
I'm so grateful to have these individuals on our senior leadership team. As I close our presentation, I hope that after hearing the accomplishments and leadership voices, you now understand why this has been a year of hope. For more than 135 years, the School of Nursing has always responded to opportunities and challenges that are presented to us. With the national and international trends in healthcare and the nursing profession, our work of leading change is again in front of us. Our remarkable heritage and resilience are reminders of our capability and our capacity. But what makes me even more hopeful is the new leadership that arises with every single generation. Recall the student that I told you about from my dean's interview, the one that tenaciously pressed me in my interview and left me feeling like, wow. During the past 9 months, I had the opportunity to observe and get to know him better. I was not surprised that he is the student representative on the Equity, Diversity, and Inclusion Council, and that he was selected as a UMB President's Fellow. And now, after this year-long interdisciplinary process, next week, we'll present the recommendations to the university. And I was not surprised when I saw at graduation, he will receive the University of Maryland School of Nursing Alum Association Award for Leadership, given to a Bachelor's of Science student and a nursing graduate who exhibited outstanding leadership in the student organizations. This is what brings me hope. It exemplifies our commitment to fulfilling the School of Nursing mission, supporting and empowering the next generation of exceptional nurse leaders. And as stellar as he is, Jordan Moses William, I'm talking about you, he is not alone. He's an example of the many awardees and exceptional future nurse leaders who will take stage on graduation and those who remain here in the school with us and will shape the future of nursing for many decades to come. And in closing, I extend my gratitude to everyone present today and to all of the School of Nursing faculty, staff, and students, and to our university leadership whose dedication has made all of these achievements possible. I want to give a special thanks to those who worked very closely with me to develop this year's program, Deborah Prout, our team from the Office of Information and Learning Technology, specifically Andy Verbis and Marcus Bryan. I know you're up there making sure all these videos go great. Giordana Synergy and her entire team from the Office of Communications who helped put the program together and prepare the reception that's waiting for you. And our colleagues from the UMB Office of Communications and Public Affairs for their special support with this program. Please join me in the lobby for the reception. But first, I would ask that my university colleagues, the senior leadership for the university, join me on stage for a group photo, as that's been a tradition of the School of Nursing, and that the senior leadership team for the School of Nursing assemble for a photo following that. Thank you all for joining me today.